My mother and my father wanted to come because they wanted to work in the hospital in Ibenga, and they want to help the people in Sambia. And Sambia is nice.
So my name is Heleen van Mieghem. At the moment I live in Sambia, in a small town called Ibenga. It's in the copper belt. I live here with my husband, Maarten, and with my 3 children. And Maarten and I, we work as a doctor in a hospital, as a volunteer for BMI, the Bethlehem mission Immensee from Switzerland. In the morning we mostly start with a meeting with all the other members of staff, and then often there's a presentation. Often it's Maarten or me who doing a presentation on a clinical subject. Often it's tropical diseases, like we see a lot of malaria, we see a lot of TB, HIV. So there's a small clinical presentation, which is part of the education we try to give to the other members of staff. And then we go to the ward, we do a ward round, so we see all the patients, we examine them. We ask lab tests or we send them home. When that is finished, we go to the clinic to see the outpatients. That means patients who come from home with a complaint and they want to be seen by a doctor. Sometimes when children are brought in, and they're having a fever, they're treated as malaria, which often is the case, of course. But then if you take your time and then you really talk to the mother and you really examine the child, and for example you find that the child has something completely different, or has a pneumonia, or has some kind of abdominal infection, and you can treat it and the child gets better, that's a very good feeling.
The children here from my school, they all live in a house like just a small round house with grass on top, and there are just 2 beds or 3 beds. Some people don't have mosquito nets, and they haven't thought that it is standing like this, and the windows are open. They don't have glasses for the windows.
My name is Maarten Hofland. I'm a gynecologist and I'm working in St. Teresa's Mission Hospital in Zambia, in the northern part in the Copper Belt. It's a district hospital. It's not such a big hospital, about 150 beds, and we cater for most of the patients around this area.
And they must cook outside. If they cook inside, the house will be in a fire.
We see a lot of HIV also in pregnant women, because they are the most affected age group. They are the fertile women, and the percentage of HIV positivity is about 20%. So that is quite a high percentage, and it's very important that we prevent the transmission of the HIV from the mother to the child. That is a very important part of my work. There's a new policy in Zambia that all women that are HIV positive, and then when they are pregnant, they should be started on treatment, on the full HIV treatment already early in pregnancy. And that's we are one of the first hospitals in Zambia that have really started implementing that. And we are working according to that. And if you do that correctly, if the woman takes medication correctly, then the transmission chance is less than 1%. So that means you can really prevent HIV transmission, and that is a very good thing.
We are very happy, very pleased for the coming of Dr. Maarten and Dr. Heleen. They are such good doctors. Very good, very nice.
And they eat not so much. They eat just nshima with 2 pieces of vegetables. So I think they are not gonna be so big later.
With their coming, we've seen things moving with full swing. Eh? They are quite hardworking, and they pose a challenge to all of us, because they are all the time there for the patient. Even when you call them in 2 minutes, they'll be in the hospital.
We thank BMI for the support and for the continued support they are giving us. Bravo, thank you.